Hello, my name is Alexa Peña Anlaco, and I'll be presenting on the pharmacological and ethical interventions in mental health treatment. Saw 2021 states that the first inline pharmacological treatments for anxiety disorders include selective serotonin reuptake inhibitors, SSRIs, such as sertraline and escitalopram, and serotonin norepinephrine reuptake inhibitors, SNRIs, like venlafaxine and duloxetine. These medications help regulate neurotransmitter activity to reduce anxiety symptoms. NICE 2023 mentions how secondary medications such as benzodiazepines like lorazepam may be used for short-term symptoms relief, while buspirone offers a non-sedating anxiolytic alternative. Tertiary agents like hydroxyzine and pregabalin can serve as adjuncts for residual anxiety. Hoffman et al. 2012 reports on non-pharmacological interventions such as cognitive behavioral therapy, otherwise known as CBT, and mindfulness-based stress reduction are evidence-based alternatives or complements to medication. These therapies address maladaptive thought patterns and physiological arousal associated with anxiety. Bipolar and mood disorders. Getz and Milkowitz 2013 state that primary pharmacological treatments for bipolar and mood disorders include lithium, the gold standard mood stabilizer, and anticonvulsants such as valproate and lamotrigine. Secondary treatments often include atypical antipsychotics such as quetiapine, lurasidone, and olanzapine, which are effective for both mania and bipolar depression. Tertiary options like carbamazepine may be used for treatment-resistant cases. Frank 2005 elaborates on interpersonal and social rhythm therapy, otherwise known as IPSRT, and psychoeducation are effective non-pharmacological interventions that help patients maintain consistent daily routines and sleep patterns, as well as reduce relapse risk. Lifestyle regulation and social support are essential for long-term stability. Major depressive disorder, also known as MDD. The DSM-5 TR mentions how SSRIs like fluoxetine, sertraline, and citalopram are typically the first-line pharmacological agents for MDD. Secondary options include SNRIs such as duloxetine, venlafaxine, and atypical antidepressants such as bupropion and mirtazapine. Tertiary treatments such as tricyclic antidepressants and monoamine oxidase inhibitors, otherwise known as MAOIs, are reserved for resistant cases due to safety concerns. Malev et al. 2016 explains how cognitive behavioral therapy, also known as CBT, remains the gold standard psychotherapy for depression, effectively reducing symptoms, severity, and relapse risk. For treatment-resistant depression, electroconvulsive therapy, also known as ECT, and transcranial magnetic stimulation, also known as TMS, have shown significant efficacy. Personality disorders. Harris 2019 mentions how medications are not curative for personality disorders, but can alleviate co-occurring symptoms such as anxiety or depression. SSRIs are often used for affective instability, while mood stabilizers like lamotrigine or valproate may reduce impulsivity. Lineham 2015 explains how the most empirically supported psychotherapy for borderline personality disorder is dialectical behavioral therapy, otherwise known as DBT. DBT focuses on mindfulness, emotional regulation, and interpersonal effectiveness. Schema-focused and group therapies are also effective for broader personality disorder presentations. Schizophrenia spectrum disorders is our following slide, and Kane et al. 2019 states that atypical antipsychotics like risperidone, olanzapine, and aripiprazole are the first-line pharmacological treatments for schizophrenia. Typical antipsychotics, such as haloperidol and flufenazine, may also be used, though they carry higher risks of extrapyramidal side effects. For treatment-resistant schizophrenia, clozapine is the gold standard but requires close hematologic monitoring. Turner et al. 2018 mentions how psychosocial interventions, including CBT for psychosis, otherwise known as CBTP, family psychoeducation, and supported employment, significantly improve social functioning and relapse prevention. Trauma adjustment and disorders. The DSM-5 TR states that the first-line pharmacological treatments for trauma-related disorders like PTSD include SSRIs such as sertraline and paroxetine. Secondary medications include SNRIs like venlafaxine and prazosin for trauma-related nightmares. Tertiary adjunctive agents such as atypical antipsychotics may be used for severe hyperarousal or intrusive symptoms. Watts et al. Explains how trauma-focused cognitive behavioral therapy, also known as TF-CBT, and eye movement desensitization and reprocessing, also known as EMDR, are highly effective non-pharmacologic interventions that target maladaptive trauma memories with strong empirical support for symptom reduction. NASW ethical responsibilities and medication ethics. According to the National Association of Social Workers, NASW Code of Ethics, social workers have ethical duties to the broader society under standard 6.01 through 6.04. 6.01 speaks about social welfare, promoting conditions that serve the general good. 6.02, public participation, which encourages community involvement in social policy. 6.03, public emergencies, provide professional support during crisis. 6.04, social and political action, which focuses on advocating for equitable access to services and against exploitation. These ethical principles are highly relevant in addressing systemic issues like pill mills, over-medicating, and big pharma influence. Social workers must advocate for transparency in prescribing and combat exploitation in pharmaceutical marketing and educate the public on ethical healthcare practices. The selected disorder that I chose was schizophrenia. What is schizophrenia? Additionally, Kane et al. 2019 mentions how while antipsychotic medication is central to symptom control, up to 30% of individuals show limited response or experience intolerable side effects. Non-adherence due to stigma or adverse effects further limits efficacy. On the other hand, Turner et al. 2018 explains that an alternative, CBT for psychosis, has demonstrated modest improvements in functioning and distress. Social workers can promote ethical and holistic care by integrating psychosocial supports with pharmacotherapy and advocating for patient-centered treatment access. Limitations of medication in schizophrenia. Barnes et al. 2016 describes that antipsychotic medications primarily target positive symptoms like hallucinations or delusions, but are less effective for negative symptoms like apathy and social withdrawal and cognitive deficits. Adverse effects, including metabolic syndrome and sedation, may reduce adherence and quality of life. Furthermore, many individuals face barriers to care such as stigma, socioeconomic hardship, and limited access to psychosocial resources. Thus, medication alone rarely achieves functional recovery. Alternative to medication, CBT for psychosis. Turner et al. Also states that CBDP aims to help individuals identify and reframe maladaptive thoughts associated with psychotic experiences. This therapy encourages adaptive coping mechanisms, improves insight, and supports social functioning. Meta-analytic evidence demonstrates small to moderate effects on symptom reduction and overall functioning. While CBTP is not a replacement for antipsychotic medication, it is an essential adjunct that enhances quality of life and empowers clients in their recovery journey. Mental health treatment is most effective when it combines pharmacologic and psychosocial approaches. While medications remain crucial for symptom management, they have limitations that require complementary interventions such as CBT, DBT, and trauma-focused therapies. Social workers guided by the NASW Code of Ethics have a vital role in ensuring ethical prescribing, advocating for policy reform, promoting equitable, person-centered care that resists over-reliance on pharmacotherapy and prioritizes holistic recovery. Finally, you will have my references. This is the first slide that include all my references and the second one. Thank you so much.